Atherosclerosis, heart attacks, coronary artery disease, this still kills 50% of the population. This is the reason why 50% of the people die. And still, the single most important test is not part of the routine evaluation. And that single most important test is something called the 3D cone beam examination of the mouth. It's a very high sophisticated test that clearly shows you any and all teeth that have infections or abscesses at the root tips. And that's how they present, infections at the root tips. The thing that has kept this test from being accepted, I believe, is that most doctors and most dentists still think that if you have an abscessed tooth, it's going to hurt. So you're going to say, Doc, this tooth is hurting me, check it out. No. Well over 95% of these abscessed teeth are completely, totally pain-free and symptom-free. And so you're not going to know that you have an infected tooth causing your angina and evolving your heart disease unless you just decide to get this test. It's like if you walk into the doctor's office, the doctor doesn't look at you and say, oh, wow, it's a good thing you came and saw me. I can see that you have a glucose of 275. We better get you on insulin. No, it's completely asymptomatic. And they have to do a blood test, a screening blood test, to see whether or not your glucose is normal and whether or not you need to be treated as a diabetic. Same thing with this. The 3D cone beam examination of the mouth, even though it's an involved test, it takes a little while, got to go to the right dentist, should be just as routine in the evaluation of any medical condition, not just the heart. Any medical condition, just as readily as getting a biochemistry panel, a complete blood count, screening thyroid test. It should be baseline done routinely. Nearly all, and I think this pertains around the world and just not in the States, but nearly all dentists who specialize in or do a lot of dental implants have the 3D machine because it's pretty much state-of-the-art dentistry and substandard dentistry if you don't use this type of thing, because it allows the dentist to more perfectly understand the unique architecture of your mouth and where is the bone density good for putting the implant and everything else. So I would start by looking at prominent implant dentists that do high volumes of implants, and actually that would end up probably being a good choice too if the tooth needed to be extracted, because then it could get extracted, and depending on the philosophy of the dentist, you could follow up with an implant.